Hi guys, it's your girl Naya. I apologize for the lack of videos again. I know I'm terrible. But in this video, I just wanted to talk about my latest doctor visit. It was actually with pain management. I see Dr. Jonathan Church with the Capital Pain Institute. I've actually been seeing him for the past 2 months. And I recently got a MRI done of my spine and my back, and an x-rays of my back, as well as my hips, my legs, and my left ankle. Those of you that know, I guess I'll start from the bottom and work my way up. The ankle was x-rayed because I had a rogue scooter back in the day that ejected me from the scooter and proceeded to roll over me and trap me underneath. And it trapped my ankle. So with that, I have had like a lot of damage done to it. I didn't break anything, but there were like ligament tears, tendon tears around the ankle. So they just wanted to check that. I do have like permanent bone bruising, but as far as right now, it's just the ankle is as okay as it can be. I do have some bone spurs and plantar fasciitis, so they were just kind of checking on that to see what was, I guess, the status of that, and it hasn't really changed, so that has stayed the same. And then moving on up, he saw that in my right leg that I was missing a piece of my fibula. And that you can still see from my past surgeries, the breaks and old fractures that I've had, whether they've healed or not. They obviously have healed, but they're still there. They're still present. There were no new fractures or new breaks of any kind, but he could tell that I have severe arthritis in my knee and my hip and the right leg. The knee on my right leg has been torn multiple times, like through my meniscus and my ACL. And what he said was pretty much that my right knee looks like roast beef. It's pretty shredded up in there. And I've actually been having a lot of pain recently in my right knee. I don't know if I like just agitated the tears or retore them, but it's been excruciating the last couple of days. I don't know if I could literally step wrong. I could move my leg wrong and I could probably tear it a million times. But whatever the case, that's what's going on with that knee. And then the right hip has arthritis as well. I think I might have said that, with some bone spurs. But I have in my left leg, I also have bone spurs. I'm pretty much bone on bone in my hip. But the thing in that, and the left knee is also arthritic and has bone spurs as well as on. It's not as, the left knee is worse bone wise, but the right leg is worse in my knee, ligament and tendon wise. So it was definitely a hard appointment just to, like, I knew all of this. Like, I knew about the tears, I knew about the bone spurs, I knew about the arthritis, and I'm basically starting fresh with the pain management. I'm actually having difficulty because in San Antonio, I was seeing, not to go off beat, but going to explain why I'm actually going to Austin. I'm from San Antonio, and I was with the UT system. I was Westgate. I was seeing the UT pain clinic, and it was rough for me because I didn't have a set doctor. I was seeing the entire system, and they just kept doing procedures after procedures that weren't working for me. It was as if I was a guinea pig, and they were just like, oh, let's try this. And I would tell them, okay, these things aren't working, but they hurt. They were painful, having to go through these procedures, having to do these things over and over. And I had the procedures done. I had the epidural. I had where they burn the nerves in my back and my hips. I had it to where the rooster injections in my knees, and it wasn't like, oh, I was getting some relief at all. No, I wasn't getting any relief at all. So with going to this new pain management doctor, I actually had to, those of you that went to XLH Day, I don't remember the name of the doctor. He was a pain management doctor. He referred me to Capital Pain Institute. And that's how I, got into the Capital Pain Institute, was off of his referral. Obviously I would have gone to Indianapolis, but funds and everything of that sort, just trying to get to Indianapolis was a little bit unreasonable. So Austin was a little closer, but they are not covered under my insurance. I am paying out of pocket to see this pain management, and I'm sure that it might be the case for other XLHers that just have to find means to an end, it seems like. And hopefully with this doctor, he is actually going to, because going back, with all of these ailments and things that are wrong with me, he actually asked me how I was surviving and how I was actually living. Sorry. And I just told him that I had to. There was no other option. Of course, there are days when I want to give up, and I just feel that sense of dread even getting out of bed or having to go to the bathroom, getting myself a cup of water. But at the end of the day, you just have to do it. I just have to do it. And that's exactly how I feel. So anyway, sorry, I didn't mean to get all emotional. But I was like, what are my treatment options so far? And he recommended the spinal cord stimulation to help my back, because he asked me like where at that moment or in my everyday life, where do I experience the most pain? And I said I experience it mostly in my back. My back is really what hurts. And then right now, it's kind of hard to say, because it's like my right leg, my right knee is giving me all of these problems, and it was hard to be like, oh, I got to pinpoint one thing, like that. Let me think about it. But I ended up telling him my back is my number one pain priority right now, because it's a constant. It doesn't go away. It hurts. And so with my back on the MRI, it actually said that I had some bulging discs in like my L4, L5, spinal stenosis. I was officially diagnosed with spinal stenosis. I know that that's a widespread diagnosis for a lot of XLHers. So I was diagnosed with that. I have arthritis in my back, the bulging discs in the lower part of my spine. The sciatica is being affected. So his recommendation was a spinal cord stimulator. So, but of course, out of pocket, that would be a couple of $1,000s. He said anywhere from 17 grand and up. And that wouldn't include like needing to be sedated, needed to, like the actual procedure, paying to the doctor, doing things of that sort. So and that would just cover my spine or my back pain. It wouldn't cover my knee pain. It wouldn't cover my hip pain. It wouldn't cover my, like other pains that I have. It's just trying to focus on the back. And another option was, but it didn't seem like it was really a viable option, because he was very adamant about not being on opioids. But one other option was the pain pump. But he didn't want to see me on that, just because it is, no matter the dosage and no matter the small amount of it, it'd be opioids for the remainder of my life if I decided to keep the pain pump. And again, that was a couple of $1,000. and not including A, B, and C, doctor, anesthesia, and if need be, and all of those other things that I would have to go through. But he did up my Lyrica to 3 times a day. I was taking it just at night, but I didn't feel any effect of it. So I will be taking Lyrica 3 times a day. And then he kept me on my tizanidine. I take tizanidine to go to sleep at night. I take 2. That because I can't take Ambien because I would sleep shop on Amazon. I ended up buying a rubber chicken. That's how bad it got at one point. For no reason. Didn't even remember buying it until it got delivered to my house. But that's a whole other story. But if anybody has any recommendations for a pain management doctor in San Antonio or anywhere close that would take Melina, that's my other problem that I'm having, is that a lot of the pain doctors here didn't want to take my case because I was so extensive. A lot of them don't take my insurance. So if you have any recommendations for somebody who would take Melina Dual Care, that's the insurance that I am currently on. Or if you have any recommendations for, he also wanted me to go to physical therapy. So if you have any recommendations for physical therapy or know that this insurance would be covered, please reach out and let me know. And ultimately, I was making this video to let others know that I'm with you. I have pain. I have similar ailments. And just to know that you're not alone, and to help me feel like I'm not alone in this situation. But if anyone has any questions, comments, concerns, please reach out. And thank you so much for watching. I appreciate it. Bye.